Hi, everybody. Welcome to Positive Health. My name is Skylar Griessel. I'm so excited to host you through this presentation of mindfulness and menopause today. I'll probably give it a couple minutes before I officially start all of our content. And Kim, I know you're here as well. Would you like to share any information with us before we officially start?
Hi, Skylar. Yes, thank you for being with us again today. And hello to everybody out there. Thanks for joining. And this is the second webinar of our monthly Mindfulness and Menopause webinar series. And we'll have more to come each month throughout this year. And Skylar Griessel is here as our mindfulness mentor to share some information today and practice on hot flashes and cooling breath work. And I am
Yes.
Fancher, and I'll be your moderator, and I'll be checking out the chat area for you all today. If you have any questions for Skylar, just put them in the chat, and we'll bring those up during the Q&A portion. And Skylar, I want to mention also that there is a show captions feature with this Zoom app. And so people can turn that on and select whatever language is most suitable for them. And also just let everyone know we are recording this webinar so we can make it available for those that will be wanting to view this on demand. So with that, Skylar, I'm going to pass it on to you and let you run with it.
Perfect. Thanks so much, Kim. I am just honored to be able to do this and to work with you and Colette and put together this information. I think mindfulness is having a bit of a moment, which is a good thing for everybody. And folks are really starting to learn the benefits of this and how it's related to managing certain health conditions and just certain life experiences like menopause. So today we are talking about mindfulness and menopause, and we're paying special attention to the breath. We're going to practice a couple different breathwork techniques today. Each one of these presentations goes through a little information about the symptom itself. Today, we're talking about hot flashes, and then we'll do some hands-on mindfulness technique practices. You are always more than welcome to ask questions in the chat box, as Kim suggested. Please note that I am not a medical professional. The advice and practices provided in these sessions are not designed to replace any kind of medical treatment, and you always want to consult with your doctor about your healthcare needs. So welcome to Positive Health. This is the change for the better. This webinar series will consist of mindfulness practices. My name is Skylar Griessel. I am your mindful mentor today. I am also a certified yoga instructor, and I get to teach meditation and mindfulness practices in various capacities. I also teach yoga and Pilates around the community, and I just think the physical health and the mental health are so closely linked together that we can use one to hack into the other. And we'll talk a little bit about that today. You may see me look around a little bit. Now, this content and this series, everything we talk about in mindfulness and menopause is designed to encourage women to embrace the change with kindness and self-compassion. So congratulations for showing up today. Thank you for taking the time to do something for your health and your well-being. Give yourself a little gratitude right now. You might put your hand over your heart. This action actually releases serotonin in the brain. You might take a little breath and just let the corners of your mouth curl into a gentle smile. Give yourself gratitude. I get to be your mindfulness mentor through this entire series. I will facilitate these sessions and your guided practices. I am also very happy to host question and answer sessions at the end of this. And now there are no stupid questions, there are no odd questions, and some of these practices might even feel a little odd to you. So please remember, this is a safe place. We will respect everyone's opinions and experiences and questions here. And if you're new to mindfulness, please don't worry. The content presented here is open to everyone. I hope these practices will help you just fill your toolbox with new skills to help you gracefully and happily move through your menopause journey. Mindfulness practices have been proven to help women cope with the many symptoms of menopause. In this series, we'll explore various mindfulness skills and coping mechanisms. You can expect hands-on practices, and then you can collect tips on how to incorporate mindfulness into your daily routine. When I refer to your toolbox, I'll tell you one of my favorite things about mindfulness practice in general is that most of these practices are free. You don't need any special equipment. You don't need a gym membership. You don't need anything at all to practice this except your mental presence and today, your breath work. So we'll go through what that looks like. Before we do, I'll give you a little more information about the total series in general. As Kim mentioned, I'll present something to you once a month. We talked a little bit about visualization last month in terms of using a visualization to cope with hot flashes. The rest of this series will branch out into other symptoms and areas of menopause. We are still talking about hot flashes today, since it is the most common symptom of menopause. We'll spend extra time there. Next month, I'll talk about the vagus nerve. You'll hear me mention this today, but it's a brainstem nerve at the base of your skull that controls your body temperature, breathing rate, and blood pressure. So we'll get into that a little more next week. Today, we're talking about cooling breath. We'll use 3 different breathing techniques to promote cooling and relaxation in the body. Now, through the rest of this year, you can expect to talk about sleep problems with me, another common symptom of menopause. We are going to use box breathing today and in the sleep problems presentation. We will do a hands-on relaxation practice, and then I'm going to guide you through a yoga nidra meditation, which is really deep, concentrated thought on the physical body to promote a really, really good night's sleep. And again, these practices are all free. Now, emotional health is another hot topic when we talk about menopause, and it's often one of those things that we put on the back burner already. When we talk about health, we spend a lot of time analyzing our diet and our exercise and our medications, but we don't often talk about emotional health, especially when it has to do with this huge journey and all these other big changes that we're dealing with. So in terms of coping with anxiety and depression and some of the other emotional side effects of menopause, I'm going to offer you a 4-7-8 breathing technique, super helpful for folks who deal with anxiety or panic attacks. And then we'll go through an affirmation and reflection practice. And the last thing we'll talk about is libido. Remember, this is a safe place, and we've got to talk about another super common symptom of menopause is low libido, or sexual discomfort. So I'll take you through a body scan practice, and then we'll do a body positivity affirmations practice. And I really hope you can make it to that one, because those are tips and tricks you can carry with you in your heart all day. So without anything else to say about that, I'm just keeping one eye on the chat, making sure I don't have any questions, but please feel free to drop anything in there if you have questions or if you want to reflect on any of these things. I'm ready to jump into how we use mindful breathing to cope with hot flashes. Now, to do that, we do have to kind of talk about where a hot flash comes from and what we can do about it and what's actually happening in the body. So first things first, using cooling breath to cope with hot flashes might feel maybe far-fetched, because a hot flash can come on so suddenly and it can be so extreme that if you're going through that process and if someone tells you, oh, well, just sit quietly and take a few deep breaths, that might not be the most helpful thing or what you actually want to hear in that situation. So doing cooling breathing practices outside of the experience of having a hot flash can really help us once that hot flash comes on, because the brain already knows, oh, I've already got this really awesome practice that can help me cool the body and relax the mind. So that's what we're doing today. Taking control of the breath can alleviate the symptoms of a hot flash. Today, we'll learn 3 breathing techniques that you can practice anywhere, anytime. If you're familiar with yoga, you may have heard the word pranayama. Pranayama just means breath. It just means breath and the energy that we cultivate using the breath. Now, you probably already know that when you're stressed or angry or in an emotional state of stress, you probably quicken your breath. You're breathing very quickly. Now, that's a normal emotional response, but it also means your heart rate quickens and your body temperature goes up. We can learn to control the breath, slow it down on purpose to lower the blood pressure, lower the body temperature, and slow that rapid heart rate. So pranayama is simply the breathing techniques you use in yoga practices. So these practices have been around for a really, really long time, and regardless of what you call them, studies have shown that they have some radical benefits when dealing with symptoms of hot flashes and sometimes other chronic conditions as well. Tips for today's topic. The first thing I'll highlight is just keeping an open mind. The 3 breathing techniques we will use get more interesting as we move through this presentation. The first breathing technique we'll talk about is diaphragmatic breathing. If you've ever played a wind instrument, you're probably familiar with this. Typically, humans breathe from the lungs, which isn't a bad thing. That's what they're there for. But we want to really mindfully take in so much air that we expand the belly. And we're actually going to watch a video about this to get a better example. We want to breathe out slowly, making that exhale really slow and controlled. And each one of these breathing practices is really going to help cool the body. So if you don't take anything else with you today, slow, controlled exhales. Release that heat. The second breathing technique we're going to practice is box breathing. This is one of my favorites. I use box breathing every time I can't sleep, but you can always use it as well to just cool down the body and relax the mind. Box breathing has a focus component, which means we are actually counting 1, 2, 3, 4, the inhales, the hold at the top, the exhales, and the hold at the bottom. So we'll go into that practice, and we'll do that a couple times today to get kind of familiar with it. And then the last thing I will share with you is what Westerners might call taco breath. And that doesn't refer to a smell, thank goodness. But if you're from India or familiar with yoga, you'll call it Sitali Pranayama. So Sitali Pranayama is curling the tongue and inhaling through the mouth, cooling the tongue, cooling the saliva, and then exhaling slowly through the nose. So I'll give you an example of this as we go on. But again, please remember, safe place. Everyone's welcome here. And with this one, you kind of do have to let go of looking a little silly. You'll just have to accept that you might look a little silly doing this, but the benefit is going to be worth it. Pay special attention to your physical posture today. If you're here and you want to type in the chat, tell me, how do we create space for the breath? Anytime you're jumping into a mindfulness practice, especially when we're focusing on breath, check on the physical body first. If I'm hunched over and my shoulders are caved in, my lungs don't have enough space to open and move and breathe. My ribs are closed around those beautiful organs. So first thing we want to do in almost any mindfulness practice is roll those shoulders down away from the ears. We don't need any help rolling them forward, how most of us sit or drive all day. We want to roll them back. Keep the chest open. Make the heart proud. You might even lift the chin slightly. If you've ever taken a CPR course, you also know the best way to open the airway is actually to tilt the chin up, to get the tongue away from the back of the mouth. As we open the throat, we allow more air to come through the nostrils, down through the trachea and into the lungs, and it actually makes it easier to use that diaphragm and expand the belly on the inhale. That's what we want. Other things you want to consider in terms of posture. We always want to find a nice, calm, comfortable seat. Ideally, we would be in a calm, cool environment, but I understand we're all householders and that doesn't always happen. That's not always available. Taking control of the physical body may also look like uncrossing the legs and uncrossing the arms. Anything you can do to promote good blood circulation and reduce any kind of stress or muscle tension is going to help your breathing practice. So before you jump in, check on the body. Are your fingers curled? Are you making fists? Is your jaw kind of tense? Is there anywhere in the body you can just offer a little tactile cue to relax, bring the shoulders down, open up the heart? Check on the body now and get into a comfortable position. I mentioned earlier, keep an open mind through these breathing practices. I also want to iterate that just consistency is key. With any new practice that we do, whether it's a new sport or a new hobby or learning a language, mindfulness is just the same. The more consistently you do this, the easier it's going to be for you to manage those symptoms of hot flashes. Now we have to talk a little bit more about this symptom as we get into our breathing practice. Understanding the science behind some of these symptoms can often help us cope with them. So what happens during a hot flash? Now the Mayo Clinic says a hot flash can typically last between 30 and 90 seconds. Tell me if this is true for you in the chat box, because although I'm lucky enough to not have experienced a hot flash yet, although I hope I'm lucky enough to live that long and get there, I do remember when my mother was going through menopause, she spent a little more time out on the balcony in the middle of December alleviating her hot flash, a little more than 90 seconds probably. So that might not be true for everyone. So that's an average. And the Mayo Clinic also tells us there's a difference between standard hot flashes and ember hot flashes. Standard ones are those that spike your temperature really fast and maybe they only last 90 seconds. Ember hot flashes are completely different. They creep on slowly, and the Mayo Clinic says that they can last 30 minutes or longer. So whether you're experiencing one or the other, or unfortunately you got to go through both, these breathing techniques can help. Consistency is key. The practices you do today, I encourage you to carry those practices with you. A little more information about a hot flash in general. We know that hormone changes in the body make the body extra sensitive, and they change up the brain a little bit. So any change in temperature, whether it's something you eat or a room that you walk into, or maybe just a night sweat that happens in the middle of the night, these things can jumpstart the body's attempt to cool down. The brain thinks that the body is too hot, and so it tries to cool down and alleviate that heat. So blood rushes to your chest and face, you start sweating, and your body attempts to cool off. Knowing that this happens in the brain can actually kind of help us when we are talking about coping with this. We need to understand the myths of a hot flash. The body temperature actually isn't rising. Decreasing estrogen affects the hypothalamus and confuses it with inaccurate messages that cause the body to heat up. This is a false alarm. The body actually is not heating up and your core temperature is not changing. Unfortunately, it does trigger our stress response, our fight or flight. We notice something uncomfortable happening in the body, and all of a sudden we are in fight or flight mode. The heart starts racing, blood starts pumping faster, muscles may tighten and activate the sweat glands. Knowing that we can activate the parasympathetic nervous system to stimulate that vagus nerve, slow the breathing rate, we can stop this before it gets to that extreme fight or flight response. You have the power and control to take control of these hot flashes and to manage your symptoms. Mindfulness practices are just one of the ways we do that. Do your best to calm that fight or flight response. I'm sure most of us are familiar with this already. Stress responses have been a topic in health for many years now, which is a good thing. And if your doctor is not asking you about your stress levels, that might be a good thing to bring up at your next visit because it affects everything. It's part of your holistic health. What else happens in the body when we experience fight or flight? And you can type in the chat what you notice in your body. For me, it's my shoulders. When I'm stressed, my shoulders always creep up to my ears. Maybe I even tense my jaw. Or if I'm real stressed and in fight or flight, I'll grip my knuckles or my fists very tightly. So notice what happens in the physical body. Things that we can't see during fight or flight are an increase in blood pressure. The body temperature goes up. We know that. Muscles get tense, your breath rate quickens, the metabolism slows down, the reproductive organs slow down, and the immune system slows down. That's why your friends who are always in a constant state of stress get sick really easily. Their immune system doesn't have time to process. So again, you have the power and control to recognize those fight or flight symptoms. Know your body and know yourself really well. I told you my shoulders always creep up in my ears. As soon as I feel that happening, I stop and take 3 deep breaths. My gateway to relaxation and my first step in stopping and calming that fight or flight response. So find what works for you. I believe we're ready to get into our practice. You can find a nice comfortable seat. We're going to use the breath to combat the symptoms of hot flashes. And I'll ask you later today which of these practices works best for you. If it's helpful, you might grab a piece of paper and a pen to just jot down things that are working well, things that came up for you, things that may have been more challenging than you anticipated. The first thing we'll talk about is how the breath regulates body temperature. Now, since we've talked about stress and fight or flight, we've kind of connected these already. Consider how the breath changes with emotion. Think of a time when you didn't feel so good. Maybe you were depressed or feeling a little sluggish and lethargic. How was your speech? How was your breathing? Excuse me. Were you taking long sighs and exhales? Exacerbated. Think of the time you were maybe angry or frustrated. Were your nostrils flaring, taking those short, quick breaths that we associate with stress and anger? So we know that changes in emotion affect the breath. Let's reverse that process and control the breath to control changes in emotion, right? Instead of getting to that extreme fight or flight response, control the breath and activate the parasympathetic nervous system. How do you breathe in a state of relaxation? Think back to a time where you were relaxed. The last time you were relaxed. Maybe you were so lucky that it was just this morning. Maybe it was a week ago. Maybe it was last weekend when you had a walk in the park or went to the beach or got to sit next to the pool. Think of a time where you were relaxed. What did you notice about the body and the breath? Probably not very quick, probably not very hurried, probably not a lot of muscle tension. Finding those little key factors can help us control how the body reacts during a hot flash. Recognizing what's happening in the body and knowing that, oh, this is a false alarm presented by my brain can help us take more control of how we handle that symptom. Now, the average adult takes 13 breaths per minute. As we're talking about the breath, typically humans breathe shallowly, and that's not a bad thing. They breathe just with the chest. I invite you to just put a hand over your heart right now if that feels comfortable enough, and you might just take a deep breath in and feel the chest move. As you exhale, you'll feel the chest fall. So these shallow breaths, we call them shallow because they only occur in this top portion of the body. They only occur in the lungs. Not a bad thing. We're keeping ourselves alive. That's what the body is designed to do. Most folks take 13 of those shallow breaths per minute. Maybe more, maybe less. Definitely more if you struggle with any kind of breathing issues like emphysema or COPD. The first technique we're talking about today is diaphragmatic breathing. Right under your beautiful lungs is this awesome pancake-sized muscle called your diaphragm. Now, it sits small and skinny under the lungs, but when we inhale and take in air, the lungs expand, the ribs open up, and the diaphragm actually gets bigger. That's why you see people take a big breath and their belly comes out. We want the belly to come out. Now, for women, I think this is especially difficult because all day, every day, we are told to suck in the belly and have nice tall posture and pull in those abs. Here, I want you to push out the belly as much as you can. We'll go through this practice hands-on in just a moment, but a little more information about the diaphragm and diaphragmatic breathing. Normally, since we take those 13 breaths a minute, we really need to mindfully think about how deeply we are inhaling and how slowly we are exhaling. So remind yourself that there's no rush here. In mindfulness, we do not rush. Practice that paced diaphragmatic breathing. Our aim is 5 to 7 breaths a minute. Now, you don't lose any points if you don't get there, and you don't get any bonus points if you only take 4 breaths a minute, but that's the goal. 5 to 7 slow, controlled breaths in 60 seconds. The last thing I'll tell you is to breathe slowly and deep enough to move the diaphragm. That's that muscular wall located beneath the lungs. So earlier I asked you to put one hand on your heart and feel the breath there. I'm gonna ask you to put the other hand right over your belly button. Take a deep, full breath in. Feel the lungs expand and the ribs open, and now breathe so deeply that the belly pushes out. Suck in a little more air, a little bit more, and exhale slow and controlled through the mouth. As you exhale, you'll feel the belly concave, so belly button sinks back in towards the body, and you'll feel the chest fall and the ribs close around the lungs. Take a couple more of those. Deep, full breath in, all the way into the belly, letting the belly expand. Deep, full breath out. Continue that pattern of breathing as I pull up your video. This is a short, maybe 2 or 3 minute video with a medical professional talking about diaphragmatic breathing. She'll go over some of the things I already mentioned, but I encourage you to write down any extra tips and tricks that might be helpful to you.
Hello, my name is Dr. Susan Jewell, and on behalf of Expert Village, I'm going to talk to you about how to live with menopause. Now, in this clip, we're going to talk about ways of breathing to reduce anxiety, to reduce the frequency of hot flashes and so on, symptoms that you find when you're in menopausal stage of your life. Now, paced breathing is a method that's recommended for most women when they are actually entering menopause or in menopause. Now, what is paced breathing? Well, studies have shown that if you do regular, proper technique of breathing, it actually reduces the frequency of hot flashes and the duration of the hot flashes. And also it will help you to reduce your anxiety. It will improve the circulation of the body. So I'm going to show you how to do paced breathing. Basically, what you do is find a nice calm room, and it's also good to put on some really nice, calming, relaxing music in the background. And what you do is you breathe in very deeply, you inhale, and you inhale deeply using your diaphragm muscles. Now, your diaphragm muscles very quickly is, say, for example, this is the chest, is the neck and the shoulders. And here's your waist here on your belly button. So your diaphragm muscles in your thoracic or your chest area. And here's your lungs here, your 2 lungs. And it's a muscle. Your diaphragm muscle, this is your diaphragm muscle here. And when you breathe out, the diaphragm descends. When you breathe in, it goes up. And most people breathe from the throat here. But really when you want to take in a lot of air, you want to really use your diaphragm so that you can have more room, more volume to actually have air going in and air coming out. So, paced breathing, you breathe in deeply using diaphragm muscles for 5 seconds, and then you breathe out slowly for 5 seconds using your diaphragm muscles. So let me do that again. So 5 seconds in, using your diaphragm muscles here, your stomach muscles, your diaphragm muscles, for 5 seconds very slowly. It's recommended to do like 15 minutes of this every day, maybe twice, two sessions a day will be absolutely wonderful for you. It also relaxes you, and it makes you feel really, really good at the end. Here's a picture that I've got of a woman actually doing paced breathing. And it's good, like you said, she has her head leaning back, and she's really breathing in. She's very relaxed. See all the muscles right here, the neck is relaxed. And this is a very good method, as I said, to help you reduce the occurrence and also the duration of hot flashes.
The best prayer to attract wealth begins when you understand that.
Well, so there's a little extra information on that diaphragmatic breathing or paced breathing for you. Tell me in the chat box if you noticed anything that surprised you, if you thought something was especially interesting. Let me pull this back up. When she says, a nice quiet room, maybe put on some calming music, best to do this for 15 minutes. Please release yourself from those expectations. I understand that that is not always possible, especially if we're experiencing a hot flash in the middle of the grocery store. So you can still do this technique, even if those things aren't exactly available to you. And maybe you don't lift your head all the way up, but just having the idea of opening up the throat, opening up the lungs, and really expanding the belly on purpose is going to be the best way to get into this practice. So let's take 60 seconds. Practice this diaphragmatic breathing. If you want to, I recommend maybe putting both hands on the belly or go back to that position of one on the belly and one on the heart. Take a deep breath in. Pull air all the way into the belly. And when you think the lungs are full, pull in just a little more air and exhale out slow and controlled. Now, our wonderful clinical professional said 5 seconds. That's a good goal, but release yourself from that expectation. Deep breath in, all the way into the belly. Pull in a little more air. Exhale it out. Give me at least 3 more breaths, just like that. Deep breath in. Slow, controlled exhale. Two more. Last one. On this inhale, really push the belly forward. Find that muscle. Feel it expand as you inhale, inhale, inhale. Inhale a little more. Exhale, slow and controlled. Well done. Feel free to continue that breathing technique. As we move through this presentation, we'll follow this pattern. I'll introduce our technique, we'll practice it together, and then we'll talk about what did you notice. Now, diaphragmatic breathing is probably the most accessible. It's the one that doctors talk about most often. It's a practice when we have COPD patients and we want to better their lungs. We talk about diaphragmatic breathing for folks who play the saxophone or the flute or the harmonica. So finding that muscle isn't such a foreign concept anymore. The benefits, however, continue to surprise people. Diaphragmatic breathing, even just for 5 minutes, has been shown to lower blood pressure. It's been shown to clean the bloodstream of toxins. It slows the heart rate, releases muscle tension. It can improve the immune system, improve the digestive system because we're doing the opposite of fight or flight. It also provokes feelings of relaxation and calmness, and it can lower the body temperature. So just as our clinical professional said, this is a really good way to reduce the symptoms of menopause, and that very technical phrase that she used, it just lets you end up feeling really, really good afterwards. Feel free to share anything that you noticed. As we move through our next technique, I encourage you to always bring the mind back to the breath. Technique number 2 is box breathing. Again, this isn't a super foreign concept, but I do hear of this less often than diaphragmatic breathing. Box breathing is one of my favorites because I am a go, go, go kind of person all the time. And although I really like that and my ambition is a favorite thing of mine, slowing down is also very good for my mental health, and I know I need to do that. Box breathing is one of my easiest and quickest ways to get there, to find that relaxation response, especially if I'm in a state of stress or physical discomfort, or if I'm just trying to get a good night's sleep. Box breathing helps us focus the mind. We are literally counting the inhales, counting the exhales, and we are counting the hold at the top of the breath and the hold at the bottom of the breath. So this can help us promote relaxation. It enhances the effects of deep breathing without forcing ourselves to take really long breaths or really long exhales. You actually want to keep this as consistent and equal as possible, just like a perfect square. So if you imagine a perfect square or a box in your head, we are going to inhale for a count of 4. We're going to hold at the top of the breath for a count of 4. We're going to exhale for a count of 4, and then we'll hold at the bottom of the breath, lungs completely empty, for a count of 4. So feel free to practice with me. If 4 seconds is too long or too short, feel free to adjust as necessary. For example, if you did play the harmonica or saxophone, you may have more lung capacity than I do. Your breaths may be 5-second inhales, 5-second holds, and so on, or maybe 6. The longer you can make these inhales and exhales, the better, the more relaxation response the body will go into. However, that's not always the goal. 4 seconds is a really good place to start. So find that nice, comfortable posture again, feet flat on the floor. Relax the arms, roll the shoulders away from the ears. Find that nice, clean passageway for air. You might lift the chin slightly. Take a deep breath in for 4. Hold it. Exhale. Hold it. Inhale. Hold it. Exhale. Hold it. Inhale. Hold it. Exhale. Hold it. Inhale. Return your breath to normal. Give your body a little shake if you need it. We are going to practice this on our next slide with an image. So we're going to be watching a video that literally counts down the inhales and exhales. Do your best to follow along. If the breathing ever feels irregular, or gosh, if you feel dizzy, please feel free to stop. You can jump back in if you want to, or adjust this practice as necessary. Maybe your inhales are a little bit deeper. Maybe your exhales are a little bit longer. Forgive yourself. This is a safe place. So go ahead and jump into this practice whenever you're ready. You can watch the numbers on the screen, and just as it suggests, that white word, the one that's highlighted, is where we're going to be. So on that breathe out, fully exhaling and emptying the lungs, holding at the bottom of the breath, and ready, set, inhale, hold, exhale, hold, inhale, exhale. Oh, sorry, hold. Now exhale. Hold at the bottom of the breath. Inhale again. Hold at the top of the breath. Exhale. Hold at the bottom of the breath. We'll go through this one more time, and then we'll click back and kind of check in with the breath. Hold at the top of the breath. Exhale. Hold at the bottom of the breath. Inhale. Return your breathing to normal. We're going to go through that practice one more time. Again, I encourage you just to discover what you discover. Maybe that's too short and quick for you. Maybe it's too long. All of those things are okay. Remember, no bonus points and no losing any points. That practiced focus of counting the seconds of inhales and exhales really helps focus the mind. So if you're a go-go-goer like I am, or you get that hot flash and it also triggers an anxiety attack, box breathing is a really good technique for you. This is another one where consistency is key. The more often you do this, the easier it's going to get. So you might set aside 1 or 2 minutes a day in the morning, or maybe right before you go to sleep to do this practice. So I'm going to click over to that next slide again so you can jump in. Take one full deep breath, empty the lungs, and get ready for those counts of 4. Hold it. Hold it. Hold it. Hold it. Appreciating the rest at the top of your breath and appreciating the pause at the bottom of your breath are excellent mindfulness practices. Appreciating that where each breath ends, the next one begins automatically, organically, is a beautiful thing. Notice the physical sensation of breathing. As you inhale, filling the lungs, expanding the diaphragm, opening the ribs. As you hold that air in, stirring up and cultivating positive energy for yourself. And appreciating the exhale, noticing yourself breathing out, letting the ribs close around the lungs, completely emptying the lungs, letting the belly concave. Finding rest at the bottom of the breath, breathing in again and letting oxygen nourish every cell in your body. Take one more full rotation through this box breath, exhaling everything out, holding at the bottom of the breath. Inhale. Hold. Exhale. Hold. Inhale. And let your breathing return to normal. Feel free to relax. Give the shoulders a little rock side to side. Feel free to tell me in the chat if you noticed anything about box breathing. Like I said, this is one of my favorites, so I'm a little bit biased, but hopefully this worked for you. And if it didn't, don't worry. We have one more technique before we close out today. Box breathing is especially helpful for those struggling to sleep or anyone experiencing anxiety or panic attacks. We'll talk a little more about this in our sleep problems presentation, as well as the emotional health presentation. The benefits of box series are as follows. We know that focusing on counting the inhales and exhales helps stimulate the parasympathetic nervous system, and it also helps focus the mind, alleviating us from focusing on those negative or intrusive thoughts. We're counting 1, 2, 3, 4. We're counting 1, 2, 3, 4. Slowing the exhale, we know, automatically triggers that parasympathetic nervous system, the opposite of fight or flight. We know that box breathing can also aid in coping with mood swings or other emotional health issues. And this practice usually ends with a sense of control and accomplishment. You always, always have control of your breath. So hack into that. Give yourself a little gratitude for going through this practice today. Studies have shown that consistent breathwork practice can enhance self-esteem and actually provoke feelings of confidence and liberation. And that's how we want to move through our menopause journey. Confidence and liberation. High self-esteem. Love yourself through this journey. Let these breathing practices be part of your self-care routine. We have one more technique to go through. Now, I told you this is also called taco breath, and it is because we roll the tongue in the shape of a taco, like this. If you can't curl your tongue, don't worry, I'm going to give you an alternative. And I said earlier, you kind of have to let go of the idea that you need to look perfect all the time. You're going to look a little silly doing this, but the benefits are real. This practice is the oldest out of each one I've mentioned today. This practice originated, we think, in India. It's often connected with yoga practices. Pranayama in general, or breath work, is one of the branches of yoga. Yoga is not all fancy poses and flexibility. There's actually 8 branches, and breath work is one of them. Manipulating the form of the mouth during the inhale actually invites coolness into the body. As always, that slow, controlled exhale is going to calm the mind, but it's also going to release heat. Now, these exhales we want to do through the nose. Pay special attention to the temperature of the air coming into the body instead of the heat coming off of it. So you're going to focus on that air coming in, coming in, coming in, and then slow, controlled exhale through the nose. I'm going to show you a video for this one as well. And disclaimer, this video is, I guess, amateur, I suppose I would say. It's just from a yoga studio, but it was the best one I could find that really showed a good example with an alternative for folks who can't roll the tongue. Before we jump into our video, go ahead and find that comfortable seat and we'll go through this practice together. Stick your tongue out if you can. Roll the tongue into a taco shape or a tube. And as you inhale, you're going to pull in as much air as you can through that tongue, keeping it exposed to the air if it's available. Before you exhale, pull the tongue back into the mouth. Push the cold tongue up against the roof of your mouth, appreciating that coolness, and slowly breathe out through the nostrils with closed lips. 2 more just like that. Make that tube with the tongue. Inhale, inhale, inhale. Focus on the coolness of the air. Cooling the saliva. Pull the tongue back into your mouth. Close the lips. Push the tongue up against the roof of your mouth and exhale. 1 more just like that. This practice actually invites something cool into the body. So you don't have to run to the freezer and grab an ice cube. You can actually use air to cool down the saliva in the mouth. Find that coolness within the mouth and let it radiate through the body as you release heat through the nose. So we're pulling coolness in and we're releasing heat out. That's what this is all about. So as we get into this practice, let me bring up that little video for you. And again, this is just an example. If this feels like not the best example for you, I encourage you to find other resources. There are lots of them online. And if you go into any yoga studio and you ask about this breathing practice, they will likely give you some tips and tricks. So let's go ahead.
Sit in any comfortable position with closed eyes. Now open the mouth and form the lips into an O shape. Curl the tongue lengthwise and project it out of the mouth. Inhale deeply across the tongue and into the mouth. Focus your attention on the cooling sensation of the breath. Withdraw the tongue and close the mouth. Exhale completely through the nostril. Continue Sitali Pranayam for 2 to 3 minutes. If you cannot curl your tongue, then try Sitali Pranayam. Sit comfortable with your eyes closed. Gently press your lower and upper teeth together and separate your lips as much as comfortable. So your teeth are exposed to the air. Inhale slowly through the gaps in the teeth and focus on the hissing sound of the breath. Close the mouth and slowly exhale through the nose. Repeat Sitali Pranayam 3 to 5 minutes or at least 20 times.
Your little example. Let me get back to those slides, friends. Now, whichever of those examples works for you, the idea is the same. Focus on the cooling sensation coming into the body. Deep, full breath in, cool, cool, cool the tongue or maybe the teeth. And as you exhale, closing the lips and exhaling profoundly through the nose. Slow and controlled, always, always. Now, what do you notice about that pranayama practice? Now, it may benefit both the body and the mind, just like these other two breathing practices that we did. Typically, at the end of a long exhalation, at the end of a deep breathing practice, you feel a little more relaxed, a little more at calm. And that's what we want to do to the body and the mind. This practice cools the body. It can soothe anger. It calms the mind. It can assist in focus because we're focusing on that inhale and exhale, getting the mind away from those negative or intrusive thoughts. It reduces anxiety and depression. It can support the digestive system, increase the immune system, reduce blood pressure, and balance pitta dosha. Now that's fire energy in the body. Again, this is more yoga related or Ayurveda related if you're familiar with that. But if you talk about energies and what we're using to balance the body, pitta is our fire energy. It's that spicy kind of go, go, go energy within us. So focusing the mind and body to slow down and inviting some cooling or some air into our fire energy typically cools some things down. Feel free to type in the chat box anything else you noticed about this. I'm going to challenge you with a little call to action as we are bringing this presentation to a close. Which breathing practice can you add to your self-care routine today? Which breathing practice can you add to your self-care routine today? This doesn't cost any money. You don't have to go anywhere to do it. You don't even have to get out of your pajamas. So find a breathing practice that is going to work for you. And I encourage you to find little opportunities to get it into your day. I'd say in the morning is probably best. And as we do this consistently, the mind and body will get used to this practice. Oh, I do this to cool down. When I do this, I feel cool. I feel relaxed. I feel calm. I notice the benefits of this. I notice how I feel afterwards, so that when a hot flash comes on, you can jump right into these practices and your brain knows exactly what we're supposed to do. So I encourage you to introduce these practices into your day. Usually at the end of this session, I offer a little reflection. I'm going to blow through this a little bit just for the sake of time. These are always the reflective questions I ask after any kind of mindfulness or meditation practice. How did that feel? What was most helpful? Was anything particularly challenging for you? And then what do you notice about the body? And what do you notice about the mind? So for me, I told you my stress is in my shoulders and my jaw and sometimes my knuckles. Noticing in the body after a mindfulness practice, so much more space, so much more relaxation, way less muscle tension. And in the mind, just the same. A little less anxiety, a little less depression, a little more self-love. And that's always the goal. Now, feel free to ask me any questions if you've been sticking around. I don't know if I missed any in the chat, and I know we have a couple announcements before we close everything out today. The last thing I'll leave you with is just that you have control of the breath, and it is a free tool that you always carry with you, and there's no such thing as a wrong breathing practice. We can use the breath to stir up energy and make ourselves hotter and more excited. So of course we can use the breath to calm ourselves down, to cool the body, to slow the heart rate. Consistency is key, and please be kind to yourself through whatever your practice looks like. So best wishes to you. Kim, I'm gonna just ask you real quick if I missed any questions in the chat, let me know.
No questions in the chat, but I would love to make a comment here. The box breathing, I've done that for a number of years, and I know especially it's helpful for me if I'm laying in bed trying to go to sleep and my mind is racing, and I do that, and it really does help kind of calm my entire body down and be able to get to that sleep moment I need.
Nice. I'm so glad to hear that. Yeah, see, it works. Thanks, Kim.
Yeah, I've never heard of the taco one though. That's pretty cool. Literally cool.
I'll let you go through the rest of these announcements. Thanks so much, Kim.
Oh, well, thank you, Skylar. Again, wonderful presentation. Learned a lot here and love the practice as well. I do want to mention some upcoming webinars and podcasts that we have. So May is just around the corner here, and we have a great lineup with Dr. Kelly McLaughlin from Simple Therapy, and she is going to be joining us on May 21st with a webinar to talk about managing that aches and pains that you may be feeling from some menopause symptoms, and also some information about pelvic health and emotional stress. So you can join us for that. And then May 29th, Skylar will be back again with her third session. last one on hot flashes, and this one's going to be focus on the vagus nerve. So we have that one on May 29th. And then just a quick information here about the webinar in June. We have Dr. Lauren DeWinter to provide a presentation on the bladder and vagina. So this really gets into some of the true physicality of symptoms that you may be experiencing with menopause. So we'll have that one up and going here for June 18th. And then on the next slide, we have our next podcast. We release a new podcast episode the first Wednesday every month. And so May 1st, as I mentioned about Dr. Kelly McLaughlin doing a webinar, she is also going to be a guest on our podcast series to talk about those aches and pains and pelvic floor health. So be sure to listen in on that podcast. The webinars, if you want to go sign up for them, they can be found at positivehealth.com/webinars. And the podcasts are all listed on positivehealth.com/podcast page. So keep those two sites in mind if you want to learn more through webinars and podcasts. Okay, I think that this wraps it up, Skylar. Thanks again so much for today, and I hope everyone took a little something away from all that breath work exercise we were able to enjoy.
Yeah, thanks.
Yeah.
Thanks.
Hope you have a great day.
You too. See you next time.